Hello, my friends, and welcome back. I'm very excited for our guest today. We have Dr. Dallin Mill on with us today. And let me tell you a little bit about Dr. Mill and you'll discover why I wanted to have him specifically on the show today. He's got a very interesting story, and it totally relates to us as homeschoolers and what we do. So, after graduating cum laude from Brigham Young University, Dr. Mill entered medical school at Loyola University Chicago, graduating with honors in 2008. He completed his residency training in anesthesiology at Yale University School of Medicine in 2012. While at Yale, he received the Outstanding Achievement in Medical Student Education Award and continues to enjoy teaching. During his final year at Yale, he was elected and served as chief anesthesia resident. Following residency, Dr. Mill completed fellowship training in cardiothoracic anesthesia at the Carver College of Medicine at the University of Iowa, caring for adult, pediatric, and neonatal patients undergoing heart and lung surgery. After completing his medical training, Dr. Mill moved to Colorado where he began practice. He is double board certified by the American Board of Anesthesiology and the National Board of Echocardiography. He served as clinical faculty of the University of Colorado School of Medicine. For 9 years, he served as clinical quality chair for the U.S. Anesthesia Partners of Southern Colorado. And then in 2021, he co-founded Peak View Anesthesia, an office-based anesthesia practice providing care throughout Colorado. He currently serves as vice chair of the dental committee of the Society for Ambulatory Anesthesia. He has been a return guest on the Everyday Oral Surgery podcast. Dr. Mill volunteers also at the Shalom Foundation in Guatemala City, teaching local medical students and providing care for children undergoing procedures to correct orthopedic birth defects. He and his amazing wife, Chrissy, who I love with all my heart, are parents to 5 wonderful children. And I have to say, your caboose is probably one of my favorites. They enjoy outdoor Colorado adventures together, family read-alouds, road trips to grandparents, and family movie nights. Dr. Mill, thank you so much for coming on today.
Janae, so glad to be here. I appreciate the invite, and I have to agree with you. Chrissy is pretty amazing. So
She is. Yes, she is. So the reason I wanted Dr. Mill to come on is to talk about reading and read aloud with children and what he has discovered over the years, not only with his own family, but in the School of Medicine, which is really fascinating. And I'm not going to spoil it. I'm just going to leave it there and let you go ahead and start with your story about reading.
So thank you for that introduction. And yeah, I'm really excited to be here and to tell you how a book has changed the way I'm able to take care of children. But before I tell that story, I want to tell you a little bit about sort of my family history of reading, I guess you could say. So to properly tell this, I have to take you way back about 80 years to a small town in Oregon, Junction City. It's just outside Eugene. And in 1938, my father was born in a small hospital right there in Junction City. That's actually now an optometrist office. It's on the corner of Greenwood Street and 7th Avenue, if anybody's ever been to Junction City. If you've ever been there, Junction City and Eugene, it sits between the Willamette River and the Long Tom River, and it's absolutely gorgeous. There's green rolling hills. There's these rivers and streams. It's beautiful. And my dad describes, just hearing the stories he would tell about his childhood, that he really had a Tom Sawyer childhood. And one of our favorite read-alouds for sure at in our family is Tom Sawyer. But he grew up exploring those areas by himself and cousins, even from a pretty early age. When he was 9 years old, his life changed forever. He developed a cough, fever, night sweats, and the doctors determined that he had tuberculosis. Oh. So this was just before the summer just before his 3rd grade year. And in the 1940s, they had streptomycin had come out, some other antibiotics that were starting to be used to treat tuberculosis, but there wasn't really, until the 1950s, really effective treatment of tuberculosis. So the local doctors in that small town recommended bed rest. So He spent about a year of his life in bed convalescing from tuberculosis. And really, the only interaction he had was with his parents. He was an only child. And the occasional friend that would come to his window, tap on the glass, and say hi through his window. Um, so he had a lot of time on his hands. As you can imagine, this is obviously before the time of cell phones and social media, video games. And he got through the coursework for third grade that they had assigned to him by about December. So he had
Wow.
the rest of the year, and all his schoolwork was already finished. And he started reading, and he read and he reread every single book in the house. There was a charity in that town that brought boxes of books from the library to him, and he would read those books and reread those books. His mom read to him. And it was really that time that he developed this real love of reading. And as you can imagine, after a year spent essentially in bed, when the doctors finally allowed him to kind of go back to regular activity, he basically had to learn to walk again. He was so atrophied physically, his balance had atrophied. So he's kind of starting over, learning to walk. And for a 10-year-old kid at that time, difficult to keep up with the other kids in the neighborhood, as you can imagine. So that next summer, after that school year, he spent in the library, and reading everything he could get his hands on. And I had been texting with him in preparation to talk to you today, and just letting him kind of tell me that story again, that I had heard many times. But something I thought was really interesting, that, and this is what he said in that text, that he couldn't keep up with the other kids. But while I was reading Tarzan, I could run as fast as the animals and swing through the trees. And I just think about my dad at that time, what reading did for him. It opened a whole world that was not accessible to him. And what a blessing that year was, that allowed him the time to do that. And he had the support around him that allowed him to connect in that way. And I have to tell you that, our family was directly blessed from that year that he spent from that tuberculosis. And I think that's a great sort of illustration of how challenges and trials can lead to growth. But I remember as a kid, I'm the youngest of 6 children, and I remember us all kind of curled up on mom and dad's bed, or around the breakfast table, while my dad read Rikki Tikki Tavi and Jonathan Livingston Seagull and A Wrinkle in Time and Where the Red Fern Grows. And those are cherished memories that I was able to connect to my family and to my dad when he was reading us those great stories. And although, education hadn't been really, and reading hadn't really been emphasized in his home, he was the beginning of starting that culture in our family. So eternally grateful for that.
I love that. I think one of the things I think is beautiful too is here all those stories, I'm sure those characters became his best friends, that he got to live multiple lifetimes, even though he couldn't run, which I think, holy cow, that's beautiful. Thank you for sharing that. Let's keep going. Keep going.
So that kind of leads into the next part of the story. So before my dad left Oregon and went on to get a master's degree and get a PhD later, he graduated from University of Oregon in 1964. But he hadn't been back to campus since he graduated. And early in the pandemic, he had kind of a rough battle with COVID, and really slowed down. He's 85 years old now, but had really slowed down. And I just had this urgency. Like, I felt like I just needed to take a time and go on a trip. So I gave him a call. We set up a trip to meet up in Portland, hop in a rental car and drive down to Eugene and go to a football game. So he hadn't been on campus then. And that was just a magical trip. Everything, it was like it was scripted. Everything fell into place. We stayed with one of his closest childhood friends and his wife. I got to meet them and spend time with them. We visited that little hospital that's now the optometrist office where he was born, the library right across the street where he spent summers reading. We knocked on the door of one of his other high school buddies who had turned his old family stump farm into a vineyard and a winery. And he gave us the whole tour. We, ate grapes off the vine, table grapes that he had growing on the property. It was just, everything was magical about that trip. And at the end of that trip, we got back to the airport in Portland. I got him off on his plane. I set it up so I could help him get to his plane before mine left. I get back to my gate waiting for my flight to arrive to come back to Denver airport. And I just sat down to kind of catch up on current events. And I pulled up the Wall Street Journal. I was reading the Wall Street Journal, and I came across this article, Read Aloud Can Remedy COVID Learning Loss. It's like, oh, well, this is very relevant. I have 5 kids.
Yeah.
And my wife and I had been kind of grappling with everything that was happening in the public school with COVID. And so obviously this article kind of piqued my interest. And so it was written by Megan Gurdon. She's a Wall Street Journal contributor, also their children's literature critic. And some of your readers are probably, maybe many of your listeners are familiar with her book, The Enchanted Hour. So after reading that article, I was like, I have to read this book. So I downloaded that pulled up Audible, downloaded that. I had about 5 or 6 hours of travel to go before I got back to Colorado that evening. And by the time I got home at 1.75x, I had almost gotten through the whole book. I couldn't stop listening. And so I wanted to highlight a couple things from that book that I found that really stood out to me. She talks about this group at Cincinnati Children's, and that group is led by physician Dr. John Hutton, and he's done a ton of work on the impact of early reading on children's development. And one of the very interesting things that they've done is to perform functional MRI studies on children. And functional, we all know what an MRI is, that it generates an image, whether it's of a knee or a shoulder or your brain, and it shows you the image of that structure. But what functional MRI does is not only shows you the structure, but it also shows you really what's happening in that area of the brain. So specifically what's happening where and at what intensity. So they did these functional MRI studies on children that were ages 3 to 5 and looked at what happens in the brain when the child is being read to with a picture book. And it was very interesting that it showed that multiple areas of the brain are lighting up at the same time and fairly intensely when that reading is happening. And they're seeing the images from the book. In contrast, when they showed what is happening in a child's brain when they're looking at a screen, there's a part of the brain that's really lit up, but it's just the visual cortex, and it's just one part of the brain. But that combination of reading and seeing, it's lighting up parts of the brain from really close to the front of the brain, clear back to the visual cortex, and it's forming connections. It's not only lighting up in those areas, it's helping form these connections between those areas that helps that child process the world around them, higher executive function, emotional control, all of these things that are so important, language development. And that concept really kind of hit home for me when I was listening to that, because what anesthesia does when I administer it to a patient, it's not sleep. It's not inducing a state of sleep. You're not going to sleep and waking up when the surgery's over. What it's doing is disrupting those different areas of the brain from communicating with each other.
Interesting.
So it's really what it is unconsciousness. We're taking these areas of the brain. Your ears are still receiving input into your brain. That area of the body that's being worked on, there's still signals being sent to the brain. But what that anesthesia does is disrupts those those areas and prevents them from communicating with each other. And that just created this visual in my mind when I'm reading to my child that it's connecting everything. It's connecting the brain. And I think what she also talks about in that book is that it creates connection between parent and child. And that's really, I mean, what more could you want from, in your home and with your children than an activity that brings you together, forms connection between child, parent, the family as a whole, and is connecting these parts of the brain that are helping them learn and grow and interact with the world around them. This book and I knew that. I mean, we studied it in medical school. We studied child development, but the way that she presented it, and years later, now being a father with my own children, this book had a huge impact on me.
Yeah. Now, had you been reading aloud with your kids prior to reading The Enchanted Hour?
Yes, but had I been exposed to this book as a new father with a brand new infant, that the amount of reading would have been significantly higher, no doubt. And there's a part of this that, our youngest is 6, our oldest is 15. So there's kind of like this piece of parental guilt where you're like, I could have done so much more for my children with my 15-year-old. I'm sorry. I wasn't reading to you
That's
as
how I
much
feel
as I
about
should have been.
my older kids. I'm like, oh, I failed because I stopped, prior to homeschooling, I stopped reading aloud when they got older. I'm like, well, we're good. I continue to read picture books to my kids, to my littles, but my older kids, I'm like, you're good. And then when I started homeschooling and learned about read alouds, I'm like, oh no, sit down. We're reading together as family more,
Yeah, exactly. And just the other night, we were outside on the trampoline in the backyard, and my 15-year-old came out and joined us, and we've been reading The Princess Bride, which is a fantastic movie. The book is actually super entertaining, so we've been reading that book together, and I've been reading it to our 3 younger ones, our 3 boys. But she came out and curled up on the trampoline, and we were laughing and reading for an hour out as the sun was going down and it was getting dark. And it's just, it just brings you together. And that's this magical kind of evening that we had with my 15-year-old with us. So yeah, and it's motivated me to not give up on the teenagers. I'm going to keep reading to them as much as they'll let me. So
I love it. Well, and it's so funny because I saw her the other day, your 15-year-old, and she said, I brought up something about reading aloud. She's like, have you read The Princess Bride? Because it's so funny. We were laughing so hard. And so, like, I know that it had an impact when she's talking to me as another adult about what, that time. And she even brought up, she's like, we were on the trampoline and it was just magical and we had so much fun, and I know that's probably emblazoned in her brain for the rest of her life.
Yep.
That magical time together. So I love that. I love that.
Yeah. And I
keep
think,
going.
As adults, as we're reading to their children, we're unlocking so much literature. And she talks about this in the book, in her book, but you also recommended the Read Aloud Family by Sarah Mackenzie. So thank you for that recommendation. I've almost finished that book too.
You're welcome. She's wonderful.
I love that book is fantastic too. So, but sort of unlocking this world of literature to your children, and maybe they're only getting 50% or 60% or 70% of what you're reading, but they're not bogged down in the syntax. They're not bogged down in the decoding process. And I think that's a huge piece of, maybe they're not understanding everything, but you're opening up so much more. And then on the flip side, they probably can understand, their brains can take in way more than they visually can get through, than they can decode. And it's slower. It's almost, reading. And that was my experience as a kid. I struggled with reading. I had, when I was a first grader, had some, and this was back in the 80s, so there wasn't the structure and the resources that we have now to help kids that are struggling with reading to the same degree that I think we do now. But had some, lessons, help from another first grade teacher where I'd drive over to her house and she'd kind of help me through that. And for me, reading was always a struggle. I just wanted to get the information, but I had to look at every single word and say it in my head and hear it in my head before I could translate it into what the meaning was. So having my dad reading to me, it was just, it was effortless. I could just sit and just absorb it, you know? And that's what audiobooks have done for me in my adult life, is that I can, my brain wants the information way faster than my eyes can give it to me. And that's what I liked about these two books, that they sort of vindicate that. Like, I always felt like I was cheating, and this isn't actually reading. But the amount of reading that I've done in the last 10 years because of that is so beyond what I could have done on my own, you know, not only in time, because you can do it while you're commuting, right? So,
Right.
you know, you're
And
using, yeah, go ahead. Sorry.
no, I was going to say, because as we're driving and our minds are just free to wander, you know, being able to listen to a book enables us to utilize that time really, really well and learn all sorts of amazing things while we're commuting to our different places.
Yeah,
So,
exactly.
and that's it with my kids. Like, when we go places, I turn on an audiobook, and then suddenly the car just goes totally quiet.
Yeah.
Yeah, so
Yeah. Wild Robot. We were just finishing the third book on our last road trip. Those have been kind of our kids' books right now, or road trip books right now.
I love it. I love it. So let's talk a little bit, because you've seen, you know, you've been doing this with your family now. What happened in the practice well, let's talk about how this relates to what you've seen in anesthesia. Anesthesia.
Yeah.
Blah, blah, blah. Tongue
It's
twister.
a difficult world. It was by the end of residency where I could say it and I could spell it. So it takes specialized training to tackle that word. Yeah. So as I was reading this, and also, this also reminded me. So as I was reading this book, I was listening to it and I was saying, how can I use this in my practice? Is there a way that I can utilize this to help patients? And I was thinking back to when I was 4 years old, when I was a patient. And in our family had participated in a co-op. So I don't know if you remember, families would do this. I don't know if families still do this, but you'd sort of come together, and with collective, you know, you could bulk buy things, and then everyone would show up at that person's house and take things home. You know,
I've never done that,
No,
but it
okay.
sounds awesome. It sounds awesome, though. I know people must do it, but
yeah.
Yeah.
So I distinctly remember this day where my mom took me with her, and I went over to this. It was out in the country, and we drove out to this house. And I remember, I'm 4 years old. I remember this long gravel driveway that kind of looped around in front of the house and then over to this outbuilding. So we pulled up to the outbuilding, hop out. My mom goes inside to collect the food stuff that we had ordered. And there's a couple family dogs out in the yard. So I stayed in the yard to say hello to some dogs. And as a 4-year-old, probably my etiquette with meeting a dog probably wasn't great. And this was an older dog who I don't think could see very well. So it wasn't the dog's fault. But anyway, this dog bites me on the face.
Oh my.
So get bit on the face. My mom hears the commotion. She comes running out, gathers me up, throws me in the old Suburban, and we're off to the hospital. So we get to the hospital. We're waiting there for the emergency room doctor to be available to help kind of close the lacerations on my face. And I remember laying there on that gurney and thinking about how painful was this going to be when this doctor sewed my face, you know, these lacerations closed. But I will never forget a nurse that was there, and she was so kind, and she had these little stickers, and she showed me the stickers, and they were stickers of Star Wars characters. And this is in 1983. So I think Return of the Jedi was still in the theaters then. So this is like the hottest, you know, pop culture thing that's happening. And these weren't just any sticker. They were like the puffy stickers that were, you know, amazing. If you remember
The really
from
cool
the 80s.
ones.
Yeah,
Yeah.
really cool ones. And I remember her holding up these stickers and asking me questions. And she was saying, you know, what color is this sticker? Which character from Star Wars is this sticker? And I remember being so disappointed because I couldn't remember the name Stormtrooper. She showed me the Stormtrooper sticker. I couldn't, for the life of me, my 4-year-old brain, remember the word Stormtrooper. But those stickers stayed on my dresser at home for months. I remember.
Now, did you stick them on your dresser?
Oh yeah, I definitely stuck them on the dresser myself for
Awesome.
sure. But what she was doing was she was showing me pictures and asking me questions. And one of the things that she talks about in Enchantment Hour or the Enchanted Hour is contingency. There's something about, if you just show a child a video of someone reading, that child doesn't learn anything about language really. But if a person, the parent or an adult is reading that book, there's contingency. You're looking at the child, you're assessing what they're understanding, what they're not understanding, and you're adjusting to accommodate that. And then the child also knows that if there's questions and they ask questions, that there's reciprocity. And so there's this phenomenon where you're sort of learning or that child is learning because you're interacting with them through this medium of the book. And that's what this nurse was doing with me. She was distracting me in a way, or engaging my mind in a way that it distracted me from the sensation of having my face, closed by this ER doctor. And so thinking about that experience, thinking about what I had learned about the functional MRI studies in the book, I decided I'm going to try reading to kids while they're going to sleep. So before I talk about how that process, I just want to, and I'm sure some of your listeners have been in the operating room with a child who's getting off to sleep, but I just want to describe what that looks like and what that process is. So
yes,
generally what happens is, whether the child has dental work that needs to be done or there's some procedure that needs to be done, they're brought to the preoperative area. They get in a gown. It's noisy. There's people walking around, adults. There's announcements on the intercom overhead. So you can imagine for a child, that's a fairly overwhelming experience.
And probably scary too.
Scary. Yeah. And so, the doctor, the surgeon comes and talks to the family. The nurse is talking to them. They're taking vitals. So the child is just kind of this barrage of adults, strangers coming in. And then the anesthesiologist comes in and for a few minutes talks to them, asks some questions. And everyone's trying to create a rapport with that child, but it's very difficult in that setting to really do that in any meaningful way. So once everything's ready to go, the operating room's ready, the nurse from the operating room will come out to the preoperative area and then take that child back to go to sleep. So managing that child's anxiety is a big part of what we strive to do in healthcare in general and anesthesiologists in particular. And some of the ways that we do that are, one, pharmacologically. So we can give an oral sedative that's similar to Xanax. So it's a benzodiazepine, and we give that orally. Or there's other sedatives that can be injected into the muscle or injected into the nose to help that child sort of start to become sedated before you go in the room. There's many challenges to that. One is the unpredictability of the medication. You give the child oral sedation, maybe they spit half of it out. That's a battle. It tastes horrible. So that has its own issues. And then there's 10% of kids that will have kind of a paradoxical reaction where instead of being more sedate, they become agitated. And if you've ever given your kids Benadryl, if you've ever had a child that took Benadryl and sort of did the opposite of what you'd expect, this is the same phenomenon that happens with the oral sedation. The other option is having a parent come into the room with the child. So you come into the room, the parent is there, the nurse brings the child, gets them onto the bed as best we can. Some kids are not happy with that. There's all this equipment, lights, the anesthesia machine, there's beeping, there's alarms, there's noises, and then holding a mask over the child's face to breathe medication to go off to sleep. So as you can imagine, and I've got a mask on, so the stranger with a mask is putting a mask on my face to get me out to sleep. So having a parent there, at least you're sort of mitigating this separation anxiety as opposed to me just taking that child and carrying them away from the parent. But there's challenges with that. So in general, children will mimic or mirror the emotional state of the parent or the guardian. They'll look to that. That's why, kids playing out on the playground, they play, something happens, and they look to the parent, and they're sort of looking to that parent to sort of categorize the experience they just had. So if you are a very anxious parent, that anxiety comes straight through to that child. That child feels the anxiety, and they understand this is not safe. Things are not going the way that they should. You have another parent that is very calm, very reassuring, and the child generally will sort of reflect that mood. But having been a parent in that situation myself, it is not fun. It's hard to keep it together. It's hard to keep those emotions from coming to the surface and communicating anxiety to your child. And I know that, so I do everything I can, having been in that situation, to communicate to my child in a way that minimizes that anxiety. But there's no, perfect way to address this. And on occasion, there's times where the child just does not accept that mask. And what are your options?
Yeah.
There's not a lot of options. Essentially holding the child and holding the mask. They cry, scream, they pull in that medicine, and they're off to sleep. I try to...
Oh, I was going to say, I had a child that had, when they were little, severe asthma, and we called it the chicken. Because it looked like a chicken, the mask, and we'd have to do a nebulizer.
Yeah.
And every single day it was a battle, and it was perpetual screaming, trying to get everything into him, and he'd scream and scream and scream, getting that mask on. So anyway, I interrupted. Please keep going.
Exactly. So it's not a pleasant, for a lot of kids, that's not a pleasant experience. So again, we're trying to find ways to make that more comfortable, because that child may need another procedure in the future. If this is really traumatic, it just amplifies, the next time it's even more challenging if they need to come back for something else. So I read that book. I thought about my own experience, and I said, I'm going to try this book. And so I had this collection of Usborne books, and they're all Aesop fables and the Grimm brothers fairy tales that are condensed into these small picture books, and it comes in a set of 50, I think. So I got this set of 50 books, and I just started to try books to see if I could find one that would work well. So, but there was one patient in particular that I will never forget. And she was in the surgery center for a dental procedure. She had some really bad tooth decay that needed to be addressed before it got worse and got infected, and abscess and all the bad things that can happen with untreated dental caries. And they had attempted to do this in their office, but she was wild. She apparently 5-year-old, and she was just not having it and screaming and swinging, and there was no way that they were going to be able to do that, what needed to be done in the office. So they brought her to the surgery center. So super cute little girl comes into the room with her mom, hops up on the bed, and I pulled out my book and I said, "Hey, have you ever read this book? Would you like to read this book?" And so she's like, kind of like, okay. So we laid down and started to turn the pages of this book, and we're reading the book. And then I placed the mask over, and I start with what's called nitrous oxide. It doesn't smell like anything, and it's what's also referred to as laughing gas, and you get it at the dentist, or it's frequently used at the dentist. And that just starts to help start the process of becoming sleepy. And then you add the other gas that's kind of stinky, kind of smells like nail polish, and gets the kids right all the way off to sleep. So I'm holding the mask on there with nitrous, and usually it's about 30 seconds. I can usually get to about page 4 of the book, and they're starting to, I can tell just by the way that they're acting that they're ready to add the nail polish smelling stuff. But she was not. I mean, she was answering questions about this book, and I'm pointing out stuff. I'm like, where do you see, what color's that fish? And she's answering the questions. I'm like, man, this is not phasing her. Give it another little while. It's been a minute, maybe a little bit longer. And I look over and I hadn't turned on the nitrous oxide. So she was just breathing air or oxygen. And at that moment, I was like, this is magic. This 5-year-old who was a wild woman in the office came into this room, wearing a gown, came into this room with all this stuff, this anesthesia machine, all these things, and let a stranger with a mask on put a mask on her face and hold it there for over a minute, happily reading the book. And so I knew at that moment that there is something here, and I am going to continue to do this. And I finally found the book, and I know that if you posted it, this is it.
Wish fish.
The wish
the
fish.
Wish fish. Is that now? Is that an Usborne?
Yeah.
I guess it's Paper Pie now. Is the company?
Yeah. So this is Usborne First Reader,
and I'll put this in the show notes.
Yeah. Okay. So this is based on The Fisherman and His Wife, the Grimm's tale about the woman that keeps asking her husband to go ask the fish for more wishes, and it teaches kids about not being greedy. So it's an adaptation of that. But the pictures, there's very little words. And I've gone through this so many times with the kids. On this page, I look and here's this fish jumping. And after we've read the text, if this fish keeps jumping, where is it going to land? And they have to think about it, and it's engaged. And there's that contingency reciprocity process. And when you ask a kid to point to the magic fish on this page, it can't help it. they just, their finger goes up and they touch. So instead of pulling the mask, what they generally would be doing, like trying to get this mask off their face, their hand is going up and touching the magic fish. And how do you know it's magic? It has stars around it. So I'm asking them questions. Do you want to find out what happens next? And the answer is always yes. They want to see the next page to see what happens. And the other kind of incredible thing about the process is we talked about this phenomenon where the child is referencing the parent to see, is this situation okay? They're looking to the parent to sort of provide that context and that information. So then I realized I'm going to start having the parent or their guardian be the one who holds the book. So they come into the room. I pull that chair right up next to the bed where we're going to go off to sleep. And then I say, all right, would you like to read this book? And I'm going to let mom read that. Can you hold that up? And so mom's turning the pages. And I always say, so, all right, mom's job is to hold this book and to read that book to you. My job is to hold this mask. And they're like, okay, that makes sense. Mom has a job. You have a job. Let's read this book. And what it's done is that the parent now, instead of sitting there helpless, watching their child be, a mask held on their face. And that's a traumatic thing for a parent, or it can be. Now they have a purpose. They're contributing to the care of their child. And now, the percentage of kids who don't cry now is diminished dramatically. So the number of kids crying has completely, changed. It's dropped. It's not 100%. Some kids are not going to connect with, but vast majority of kids, if you can just get a little connection with them, then they're in the book. You're good to go. They're off to sleep happy. But the other thing that's happened is that the guardian or parent, no more tears from them.
Interesting.
They're engaged. And so the child isn't seeing looking over at my parent who's crying. They're looking at a book and listening to that parent's voice read this book to them. And so it has been incredibly effective. One time I went to work and I left Wish Fish at home and I panicked. It was like, my secret move. I forgot it. So I always keep one in my car. So I always have it available, and I have multiple copies of that. Always available, so that when I'm taking care of kids, I'm prepared with the book.
I love it.
So that's and that's just the front end. That's how it's changed the experience for the parent or guardian. That's how it's changed the experience for the child. But it's also what happens in recovery. So one of the things that you can sometimes see with kids, the stress, and it's not only the stress of going to sleep with the anesthesia, it's the stress of the surgical procedure itself,
Yeah.
possibly some pain related to that procedure, or some other stressful components of the experience, that you can see that behavior changes not only in the recovery room, but later, that there's a little regression. They've progressed to a certain point. One example is that this child's been potty trained for quite a while, been doing great. They have this procedure, and then a week later, 2 weeks later, they wet the bed. You're like, what?
Mm.
Where did that come
What?
from?
Yeah.
They haven't wet the bed for 6 months. So there is this impact that can affect kids for a couple of weeks, and kids are resilient and they bounce back, and things get back to baseline. But anything I can do to minimize that is huge. And I've noticed that in the recovery room, kids, the most common sort of side effect of anesthesia is what we call post-op delirium, and it's when that child is waking up, the cobwebs are still there, they can't remember where they're at, and they generally don't even remember this part of it, but they're just swinging and flailing, and the parents were trying to hold them to keep them safe so they're not hitting their head on the side of the bed. And that can be kind of a kind of waking up, kind of not super smoothly. But what I've noticed is that when that child goes to sleep happy, reading a book, hearing their parents' voice, that often I don't see that delirium in PACU. They just wake up more calm. And I have to speculate that some of those other markers about having, wetting the bed later, or night terrors, or these other things that can sometimes be seen in the post-operative period, that those are better too.
Mm-hmm.
And so I think I'm to a point now where I'm ready to, I want this to be evaluated scientifically. So
Yeah.
I've reached out to a colleague at the Children's Hospital here, and I think I'm ready to sort of get that study on paper and start looking at this and seeing if this needs to be part of all anesthesiologists' armamentarium, I guess you could say, of helping kids around the time of surgery. So
Which
that's next steps.
I think this is, like, to me, this is so exciting because it's such a simple thing, but we know the impact it has on literacy for children, right? But to hear it from your perspective as an anesthesiologist and how you've seen it impact these kids post-op, pre-op, and post-op it still blows my mind. Have you shared with any other anesthesiologists what you found just in your, unofficial studies using this with patients?
Yeah. So in a couple of ways, one is that the nurses that I work with, they're like, man, they see this and they see how I used to take care of them, and how much it's changed how I take care of kids, that they share that. And I share it and say, this is what I've been doing. Also you mentioned that I've been on another podcast called Everyday Oral Surgery, and it's an oral surgery podcast, and talking about it there. And one of my colleagues in California, who's an anesthesiologist, he actually posted on Instagram that he had taken care of a kid. I think he was maybe 12 or 13. And he got wish fish. So from that podcast, I shared that. So, and posted that he had the kid reading the book with the kid while he started an IV, and the kid had a terrible, needle phobia. I hate needles too. I get it. I hate getting poked with needles. And he just tolerated it incredibly well. So I need to follow up with him and see if he's continued to use that in his practice. He takes care of a ton of kids out there in California. But at this point, it's anecdotal. It's my personal experience. There's no way you could convince me to go back to how I did it before, because I know that it's impactful. But until there's, really some well done studies to demonstrate its efficacy, that's what it's going to take to have more of a broad impact or acceptance into how we do things. so that's kind of next steps that I'm excited about. So
I'm excited too. I'm excited to hear what the findings are, because I hypothesize that it'll be tremendous. Like what they find will be, I think, potentially even groundbreaking as a non-scientific person, non-medical scientific person. That's my hypothesis as a mom.
yeah.
So.
And I've also kind of taken it as kind of this person, or this opportunity to interact with families and encourage them to read, and just pointing out, did you see how well he did? And often when I go and pick up or first meet the child in the preoperative area, I don't know what the percentages are, but a decent percentage, when you go into that room, the child's on an iPad and the parent's on a phone. And if you can sort of introduce this other way of interacting with your children, or just demonstrate how big of an impact it had on your child in this setting, and it can have a huge impact at home too. And just encouraging and having that conversation when it's appropriate, to encourage them to, it's like, as physicians, the more times a physician tells you to stop smoking, the probability of you quitting goes up. So I'm thinking the more time, the more opportunities I have to tell parents to read with their children, I hope that, there's more children in our community that are being read to on a regular basis. So
I love that.
Trying to impact the
family.
The family. Yeah, exactly. So
I love it. I love it. Last thoughts before we close up here.
Yeah. So just in summary, just sharing that story from my dad's experience that really changed the trajectory of his life, and by extension, my life, and the power that this has that reading aloud as a family has to strengthen the family, strengthen my family, and really help my children in every measurable outcome, academically, socially, in every way possible, benefit them and help them. And then seeing how it's translated to my work and how I'm able to take care of these kids is just, I was sold before, but now it's just, I'm a, what's the proper term? Just,
You're an advocate.
A warrior for this now. I'm an advocate. Yep. Something that I'm passionate about and really trying to implement in my own home, but then spreading the word and sharing it with as many families and homes as I can, is really kind of my goal at this point.
I love it. I love it.
So thank you for being part of my community, and
well, thank you.
And sharing what like the other author that you recommended, and helping our family, grow in these ways as well. So we're grateful to have you in our circle as well.
Likewise. Well, Dr. Mill, thank you so much. And thank you to your family, because I dearly love your family. If you didn't pick up on an audience, we know our families know each other personally, and we're neighbors. So anyway, Dr. Mill, thank you so much for sharing your stories and your insight. You made me tear up a little bit, especially at the beginning. And thank you for your wisdom and the work that you're doing and continuing to do to help families right now locally, but ultimately nationally and internationally, to help families progress. So Thank you so much.
Right.
And
thanks,
thank you for the time.
Great talking with you. Thanks for having me on.
Likewise. Hey, thank you. And mamas and papas, I want you to know you are doing better than you think you are. Keep reading to your kids. They need it. You need it. We need it. Our society needs it. Mamas and papas, grandmas and grandpas, you've got this. We'll talk next week. If you enjoyed this today, please like and subscribe. You could also join our private Facebook group at School to Homeschool, or sign up for our newsletter at www.schooltohomeschool. Have a great day.